All right. It is 5 o'clock, that time we come together. We recommit ourselves to defeating the coronavirus. We connect as Kentuckians that can't get together, at least in the numbers that we'd like to yet, though this is a big week. And this is the time where we give updates to make sure that you have as much information as possible to know what's going on during this one in every 100-year pandemic. But let's start the way we always start. It's our reaffirmation. It's about knowing that we're going to get through this, and we're going to get through this together. So say it with me. We're going to get through this. We're going to get through this together. And one last time, we're going to get through this. We're going to get through this together. We're going to get through this together because just about every day and in every decision we make, we realize that our actions can either help or harm those around us, that we are more connected than we have ever been. And that's what makes it so important that Healthy at Work is done as well as we all did Healthy at Home. We did Healthy at Home so well we plateaued a pandemic curve in a way no one has seen in human history. So let's make sure we do Healthy at Work as well. And I just want to very briefly talk about masks for the Healthy at Work part. And I'm going to start asking people out there, because this is so important. Do a post, make a video, talk to other people about why you wear a mask. I wear a mask to protect my family, to make sure I'm not bringing home this virus, because I want our economy to restart and thrive, and I wear this mask because of my faith. That in my faith, Jesus was asked about the two most important commandments. He talked about loving God with all your heart, and he also talked about loving your neighbor as yourself. We saw Presbyterian ministers talk about that the other day. We know, every scientist out there says that this helps us protect our neighbor. It is a choice to protect your neighbor. It's also a choice not to. I'm going to make sure that I continue to do it. But I'm asking you all out there that are wearing these, why don't you, on social media and otherwise, talk about why you're wearing a mask? And if you want to look at the video we put up, it's with my daughter Lila. It shows you right there, someone I love more than life itself, exactly why I would be doing it. Every state that's reopening, they are highly encouraging this. This is not a battle between political parties or ideologies. It's plain, basic public health guidance that's out there from the CDC and from everywhere else. It's the same guidance on the federal and on the state level. And it's just smart, right? There's a national health pandemic. There's a virus out there that spreads based on droplets coming from the mouth, and it spreads from person to person. So this is covering your mouth so you don't infect somebody else. The other thing we ask people to do isn't just the top 10 rules, it's the 11th rule: fill out your census. We are still in 13th place. It's like we're stuck in a rut, but if you get online, you do this, you will help out your state as we move forward. Please fill out your census. We also ask people to, now that we're specially adding these new rules, Healthy at Work, now that we need some new behaviors out there, to model those behaviors through the hashtags that we always put up with the additional one, Healthy at Work. So let's go through real quick what we have today. We continue to see a great unity out there and great moments. All right, so this is a mom making a big post, but she's got two kids that graduated at different levels. Pretty special, and she refuses here to view the glass as half empty. She sees it as half full. It's like the high school students I talked to yesterday. This is a time when our students matter more than ever, because their decisions matter in this test of humanity. Their decisions protect other people around them. Everybody counts right now, and nobody can be discounted, not for their age, not for anything else. We are all really important. All right, so this is the Fraser Museum, but retail open today. Big day, big step, and what we saw out there from everything that we could see is people trying really hard. And that's important because we have one shot at reopening the economy the right way. Let's continue to follow all those rules, to do the right things. You see a whole lot of things in there, from hand sanitizer to the mask. And let's continue to put that out on social media, because if, not that there's a competitor for the Fraser, but if somebody else is out there not doing the right things and they cause a spike, it impacts everybody. Let's remember, we're all connected. We all need to do the right things. All right. This is a graduation where Gabby had graduated, and of course her grandmother in the facility that she is in could not do a direct visitation, but a touching moment, knowing that what they are doing is the right thing for her health, even if it makes it a little bit different this year in the way that graduation is celebrated. All right. Again, look, we got people staying home. We got kids who understand and get it, who are making masks, who are doing everything they can, who want everybody else out there to be protected and safe. Everybody can get one. Why don't we honor her world and make sure that her grandparents, maybe even her great-grandparents, are as safe as they can be, and that we prevent the spread, because as we see today, kids can still get this, as can people in any age group. And finally, we lost 20 people that we announced yesterday. And we're going to continue to lose people moving forward until we're through this. These green lights, they're who we are as Kentuckians. We are compassionate. We care about each other. And when there is suffering out there, even if we don't know the specific individuals, we recognize it and we support those families. So let's continue to light our homes, our places of business, and everywhere else up green. There's going to be some more hard times before we're through this. There are going to be more people that need our help. All right, so today we're going to learn a little bit of sign language, which is going to lead us into how we're going to talk and maybe give you an even mnemonic device on Memorial Day, where this Friday we can have not only restaurants open, but groups of 10 or less getting together. Now, please keep it 10 or less. We got to do this right to work up eventually to that next level. So today what we're going to learn in sign language is hands, face, and space. Right. Okay. Hands, face, and space. We're going to do it one more time because I really want you to remember this. Hands, face, and space. All right. So, it's coming up. I'm excited to see people. I know you're excited to see people. We've made real sacrifices. It's made us lonely. Of course it has. That's really natural. And we're excited to see folks around us. But here's just a way to remember some things to think about as you're going into Memorial Day and you're having people over. First, hands. More important than ever that you wash your hands, that you use sanitizer, and that everybody else that either comes over or you go over to their place does as well. Hands, critically important. Also, don't touch people that aren't in your family unit. And it's just, again, this is still out there. We need to make sure we're still following those good practices. So number one, hands clean, and ultimately to yourself. Number two, face. Again, if you are in close quarters, wear a mask. Really important. Keeps you from infecting the people that you brought over. We heard about that birthday party. We don't want that to happen to anybody else. We want everybody who gets together on Memorial Day to do this right and safely. And second, don't touch your face. We've been talking about that from the start. Keep your hands clean and don't touch your face. So hands clean and to yourself, face covered if you're close, and don't touch it. And finally, space. We're going to be really excited to see folks we haven't in a while, but stay 6 feet apart. Do it outside if you can. That's going to make it very safe comparatively. Those are the things you can do to mitigate your risk. So, again at home, Hopefully I've said this enough times, and I'll continue to do it. This weekend, think about hands, face, and space. Let's look at our numbers for today. Again, it's one of those good news, bad news days, so the news is a little bit better, I think, in both accounts compared to yesterday. So today, again, we are right at or about that plateau. We're reporting 166 new cases of COVID-19. That's 166. After removing duplicates out of state, there were a number of those in the last 4 days. Our official number is 8,167, 8167, and that includes 108 probables. Now, what happens when we can on the probables is once they're lab tested, they may move to lab confirmed, or they could be ultimately removed at a later date. But this is with as much transparency as we can, trying to provide the data as close as today of folks that we know or cases that we know since the beginning have had the coronavirus. So 108 are probable out of that 8,167. That's out of a total number of tests of 158,672. That's up about 4,800 from yesterday. Again, our capacity, our growth in testing is a major accomplishment. And just about everything we've done to defeat this virus has been done right here in Kentucky with advice from the outside, but done by Kentuckians for our citizens. That's pretty special. That's who we are, though. We are a resilient, strong people that band together, and when we have to, we take care of ourselves. Number ever hospitalized, 2016. Currently, 474. Ever in the ICU, 879. Here's a great number. Currently in the ICU, 98. That is way down, and it's because when we saw those high numbers, we called through for each and every one of them, and we weren't getting reports back of when people were released from the ICU in a timely manner. So that is a problem and was a problem in our data and how it was reported back. But currently, as of today, when we check this, we are confident that there are 98 individuals currently in the ICU. Now, that's 98 too many, but knowing the actual numbers, checking on them, always looking for different ways to make the data better will help us make the very best decisions. My favorite number, the total number recovered, 2,919. We still continue to see cases of all age groups all over Kentucky. It's everyone from an 86-year-old female in Bullitt to a 3-year-old girl in Anderson County, from a 69-year-old male in Breckinridge County to an 11-year-old girl in Jefferson County, to a 84-year-old woman in Jefferson County, to a 3-year-old boy in Hardin County, and a 2-year-old boy in Logan County. Again, let's remember this disease spreads throughout every age group. While we are going to be able to reopen safely if we continue to follow all these rules, we got to continue to monitor it too, because we don't want anybody to get this virus. We want to contain the spread each and every day. New cases by county, 35 in Warren, 31 in Jefferson, 14 in Clark, 10 in Fayette and Kenton, 8 in Logan, 6 in Hardin, 4 in Barron, Boone, Shelby, and Simpson, 3 in Anderson, 2 in Allen, Breckinridge, Bullitt, Callaway, Franklin, Hart, Jackson, McCracken, Menifee, and Montgomery, and 1 in Boyle, Campbell, Carroll, Carter, Edmondson, Grant, Grayson, Jessamine, Madison, Pike, Rockcastle, Rowan, and Scott. So those are the cases for today. Again, pretty plateaued with all the extra testing and with all the testing we're doing in senior care facilities. Overall, a good sign. The infection rate is certainly decreasing. The overall hospitalization rate is decreasing. But now, remember, that's a snapshot for the most part from 2 weeks ago, which means that Healthy at Home was working very well. We got to make sure Healthy at Work works just as well. But we continue to lose people to this virus, and today we're announcing the deaths of 10 Kentuckians. It means between yesterday and today, that's 30, and that's 30 too many. 10 families that have lost loved ones, and while the rules today loosened up on funerals, it's still going to be really hard for these families to go through this. This is what this virus does. We're fighting it every day. I hope you know I'm fighting for every single individual out there. Hurts me every time we lose someone. It hurts that family and that community a lot more. I get that. These individuals are more than names, than ages and genders and counties, but that's what we read. So today it's a 76-year-old female from Jefferson, a 73-year-old female from Breckenridge, a 77-year-old male from Jefferson, a 46-year-old female from Jefferson, a 90-year-old female from Oldham, a 70-year-old man from Boone, a 71-year-old male from Jefferson, 79-year-old female from Graves, 70-year-old female from Jefferson, and an 88-year-old female from Jefferson. 10 is hard news. I think six of these were from long-term care facilities. We hate losing people to this virus. Today we have a remembrance so that we know and always remember that people are more than just the age, and so the numbers don't numb us. You know, I see some states out there that rip off 60 of these a day, and it feels like people don't blink. Well, it hurts me, and I know it hurts you. That's part of what makes us who we are as Kentuckians. So this is a remembrance for Marilyn Thompson. One way for us to all stay focused on fighting this virus is to remember the people it's taking from us. They're our family members, our friends, and our neighbors. We are able, when a family allows it, and there are media reports, to continue to share these stories. Tonight I want to tell you about Marilyn Thompson. Marilyn passed away Tuesday in Bowling Green due to complications of COVID-19. According to a story on WBKO, Marilyn was retired certified nursing assistant and patient safety aide for Med Center Health. She was doing just the type of selfless and essential work that so many across the Commonwealth are currently engaged in, helping those who are ill and helping our healthcare system respond to this epidemic. Representative Patty Mentor told us that Marilyn, who lived in her district, loved her grandchildren, loved singing gospel songs, and being an active part of her community. Now let's remember, that's another Kentucky community grieving, and this is an irreplaceable loss, and they all are. Every life that's lost is irreplaceable. That's a person that won't be sharing additional memories with family members and others. So let's remember Marilyn specifically when we light our houses up green. Now think about her when you ring your bells at 10 a.m. tomorrow. If you pray, say a prayer for her family, the 10 others from today, the 20 from yesterday, and the overall 376 individuals that we have now lost. These are amazing people. I want to thank Marilyn for what she brought to the lives around her. And remember that every life lost is tragic, and we got to do everything we can to prevent it. Breakdown in cases on ethnicity and race. On overall cases, 74% white, 14.75% black or African American, 5.84% Asian, 5.21% multiracial, and on ethnicity, it's 86% non-Hispanic and 14% Hispanic. On deaths, we see disproportionality that shouldn't exist, and I hope moving forward we make sure that it doesn't in the future. 77.5% white, 19% black or African American, 2% Asian, 1.5% multiracial, and then it's pretty close on ethnicity to 98% non-Hispanic and 2% Hispanic. Long-term care facilities, if there are positives in today's number, these are the positives. And remember, we're doing a lot of testing out there. Today is the lowest number of additional residents that have tested positive in a while. 6 additional residents, 6 additional staff, and what's on here from past days, no additional deaths. 3 more facilities, but again, we're going to see these numbers rise as we test every facility, especially the staff. I think we're going to see rise because more likely to be asymptomatic than the residents, but it's going to give us a good picture, and it's going to help us to make sure we do everything we can to get this stabilized. I want to ask Dr. Stack to talk here for a minute about our senior care units, but before that, we talked about our numbers and knowing that there is this pediatric inflammatory syndrome that's out there related to COVID-19. We don't have any new patients to our knowledge today. Moreover, we have reached 109 minors that were previously tested and were positive, and to our knowledge right now, all of them that talked with our folks are doing okay. That is really good news. But if we can put up the long-term care PPE regional response, Dr. Stack will talk about this a little bit. We pushed out a significant amount of PPE today. It's because the federal government has been a little bit late in what they were going to send. We still expect them to send it. We still appreciate that. But just a little bit about how our PPE program works, and this being an example of getting people what they need in a critical time period.
Thank you very much, Governor. So we were very glad to hear, I think a couple of weeks ago, that the federal government was going to ship out PPE, so personal protective equipment supplies, to the long-term care facilities across the country. So over 15,000 nursing homes across the United States. And there's been a little bit of a delay in that, and I think it's going to ship a little bit later, maybe at the beginning of June. So we're still very grateful for that resource, and we think the nursing homes need that kind of support. So we're grateful for that. So in an attempt to try to help bridge our long-term care facilities in Kentucky, we are shipping some supplies out to them, and that's up on the slide that you can see here. And I believe that was shipped out today, so they should get that soon, to help bridge our nursing home community until they can get more of these resources from the federal government. We are, in general, on PPE, we have shifted to supporting communities where there is a COVID surge or where there is a COVID response needed. So in general, for hospitals and first responders and EMS crews and otherwise, we will support those communities, especially where there's a COVID surge and a need. But in this instance, clearly we want to try to help the long-term care facilities avoid outbreaks. I'd also like to add, I'm doing this from my phone here though, we are continuing our testing at nursing homes, and so we are testing 23 facilities this week. I'll acknowledge it's a heavy lift. We are trying to reach 280 facilities as rapidly as we can, and we have an aggressive and brisk testing program, so we're going to be doing this over the next month or so. It will take a little bit of time. We know everyone would like to get tested immediately, but it's a big lift to get 280 facilities, and I would emphasize it's not just the testing. We have a comprehensive program where we work with facilities to help them with how they use PPE, how they manage their staff and they manage the patients to try to keep everybody safe and reduce the risk of spread of infection. I think we've had some very good success in the facilities we've worked with, and a lot of facilities who have expressed their appreciation for the outreach. So I know we can't get to everyone immediately. We would like to. It's just not possible with the bandwidth. But we are working very methodically to get to all the nursing homes and support that community and the residents who live there, who are the most vulnerable among us. And so, Governor, thank you very much for your support, and I appreciate it.
All right. Hands. All right. Face. As you noticed, when he walked off, the space too. So again, if a mnemonic device helps us coming into this weekend, I want to make sure it does. That PPE that we sent out, I mean, those of you that have been in this room for the last couple months know this wouldn't have been possible before. Our emergency management group, led by Mike Dossett, does a really good job of pushing this out. He's done a really good job of procuring it. My Deputy Chief of Staff, Jonathan Smith, appears to be the PPE whisperer as well, with some real success in being able to find some avenues that have really come through. And you know what? Just about all of them have been Kentuckians that had an ability to help us find what we needed. All right, our next announcement today is starting at 8 a.m. tomorrow. We're going to be providing that $300 million to cities and counties of CARES Act funding. Those are to reimburse eligible city and county governments for the expenses they've incurred. I mean, local governments have been instrumental in this public health response. Their leadership has been incredible, and it's required everybody from their police, their firefighters, their EMS, their public health units. It has been everybody on board. You do not have the success we've had against COVID-19 without strong local leaders and the expenses that they put into it. So they've sacrificed to protect others by supplying PPE, enforcing guidelines, and keeping the public informed, and I could not be prouder of their work. There haven't been Democrats or Republicans, just Americans, just leaders that care about their citizens fighting this coronavirus. The funds will be administered by the Department for Local Government based on an application process through a formula based on population that is available to each county and each city. And provided that they have enough reimbursable expenses, because we got to track this for the federal government, they will receive their full amount of that formula, with the exception that there is a portion of these funds that both KCO and KLC agreed that they would hold back in case there was a specific outbreak that required additional help. KCO is the Kentucky Association of Counties. KLC is the Kentucky League of Cities, kind of groups that help organize those two type of governmental entities. Reimbursements can include purchase of PPE for health and safety workers, expense for food delivery to nursing homes and vulnerable populations, improvements necessary for public employees to telework, expenses for disinfection of public spaces and facilities, and payroll expenses for public safety, public health, healthcare, human services, and similar employees who have dedicated substantial time to mitigating or responding to the public health emergency. We hope that this is just an initial amount we'll be providing to these local governments. Next, testing. Testing is absolutely critical to making sure that we can reopen safely, and I'm going to announce the drive-through Kroger testing sites for next week now. We are returning to Fayette County, where we'll be at the same site, Bluegrass Community and Technical College. We are moving after being 4 weeks in the Shawnee area in Jefferson County to Louisville Southern High School, an area generally that has also seen a number of cases, and making sure that we're getting as many people in that region tested. We know as we do this, there are other groups that are stepping in where we were testing to ensure that that continues. Also in Henderson, the Henderson, Owensboro, Hopkinsville, Henderson, Owensboro, Hopkins County region, all been hit pretty hard, and back to Warren County, given that that's one of the fastest growing areas that's out there. Starting now, you can sign up for these. Let's make sure we fill every spot. Let's not have any no-shows. Let's make sure that we get as much testing as possible. We have the capacity. Now we got to have the will. That's an update on how those sites are working this week. Both Louisville and Richmond are going pretty well. Actually, Richmond signups have been really good. Ohio County still has almost 300 spots available for tomorrow, and Graves has more than 350. So again, this will be the last day that they're in either of these places. This is your chance, folks. Doesn't cost you anything. Lets you know if you have this virus, ensures that you're not infecting other people. This is one of our duties as citizens in Kentucky. Want to also mention, because it's another area where we've seen a lot of cases, We continue our drive-through testing in northern Kentucky with St. Elizabeth's. They've done a lot of testing. We want to continue to push this, especially in this area. I know the leaders in this area are pretty excited about this partnership. Let's continue to make sure that we are getting people through. So our future, our safety depends on not just testing where we have the capacity, but ultimately also the contact tracing. It's nothing new. It's something that we've been doing through public health for a long time, but it requires your help. What we've got to make sure, we want to open our economy, we want to get people back, we want to get kids doing things again, we want to get them ultimately back to school. But we know there's a virus out there that we don't want our friends, our kids, and even people we don't know to get. So what we got to do is we got to contain outbreaks, and that's where the contact tracing comes in. The main thing I need from each and every Kentuckian is to answer the phone. Nobody's tracking you on your cell phone. Nobody's doing any of that. But what we are doing is calling you if you've tested positive so you can make sure that you don't spread it to other people. And then we can reach out to other people that might have been in contact with you to make sure they're okay too. It's got support like food and ensuring everybody has a safe place to be. But if you don't pick up the phone, it doesn't work. So folks, if we want to reopen in the time of the coronavirus, if we want to continue to pass this next, maybe even harder chapter in our test against humanity, I need you to answer the call. This is what we are asking of you as a citizen, of a patriotic American. Answer the call. And to the extent that anybody tries to make this political, though they're not right now, this is the White House's suggestions. The White House says we have to be able to test and trace. This is being followed by every governor across the United States. This is just good public health pushed by everybody. So while there might be some out there that try to create divisions in it, they do not exist. Don't buy it. This is just what we've got to do to be safe. It's how we've always responded in public health, and we need you to answer the call. If we do it, we can continue to have one of the best responses to a health pandemic like this that we have ever seen. And you know what? Tomorrow I'll probably put up Philadelphia versus St. Louis versus Louisville, and it's making sure we don't have that second curve. Because when you look at everything but Philadelphia, which was devastated, you see some significant bumps. I want to try to be one of the first responders to one of these pandemics that doesn't have that second bump. All right, I know we moved fast today, but I wanted to get to questions and get us in and out in this hour. But a lot of important things today, a lot of good updates. Remember, hands, face, and space. An idea about PPE, our new testing sites, and the $300 million going out to localities. Now, tomorrow, Secretary Freelander is going to walk through our guidance on child care reopenings and also talk about the ways that we have been supporting those facilities. He's also going to talk about pandemic food assistance in the SNAP program, so make sure you tune in to get that information. So today, our journalists, we've got Will Clark. Welcome, Will. Joe Sonka, Phil Pendleton, and Mike Valenti. And then I have questions from home. And I think I made you go last, Joe, yesterday, so why don't you lead us off today?
Do you think Kentucky's healthcare system is ready for a potential second spike in COVID-19 cases in hospitals like there was in mid-April? And what are the major lessons learned from that first spike that can be applied to a potential second spike?
The question is, are we ready for a second spike? Is the healthcare system ready here in Kentucky? And so even with our lack of PPE, because nobody had it, it's all manufactured overseas, even with the lack of testing, to where we were before we started taking our dramatic steps, before social distancing flattened this curve, is our healthcare system was responding and responding admirably. Now, we're not going to be in the same place because we're loosening those restrictions that we were before, but I am encouraged at the fact that the number of days that it's taken to stabilize people is a lot lower than was ever anticipated. Our healthcare professionals have proven that they can get people in, get people better, and get people out a lot sooner than anybody had expected. They've also shown their ability to be fluid. Remember when Norton created the COVID wing, when we had to evacuate a lot of the Trayton Oaks towers. So I believe that they are ready. Our orders on loosening up healthcare have required them to be ready, requires them to house a certain amount of PPE, requires a certain amount of open bed capacity that we could then ramp up. And we are working. I believe our goal is to have a 120-day supply of PPE at the state level that we can get out there. So I do believe that we would be ready, but nobody knows what the second spike would look like with this. So I think we got to be humble enough to know we got to watch the data, and then if we have to take pauses or we have to make changes in what we're doing as a matter of public policy, we got to be ready to do that. But Dr. Stacks worked with all the major healthcare systems, and it's been positive. And I hate to call it something like a dry run because it's much more serious than that. But we are seeing Warren County's hospitals pretty full, more than we'd like, primarily COVID patients, and how the overflow to UK, who I believe they're partnering with, works. And so what I expect that we will see, and this is just, again, our best guess looking at the data moving forward, is we will see regional outbreaks instead of one large spike. We've got to be ready for all of it. Karen Czar, if you test negative, is there a recommendation as to how often you should get tested to ensure you're not asymptomatic? Karen, we're working on the guidance to that. I was asking that personally today because it's important. It's now gone from do we have the resources for me or others to be tested to now what's the regular testing process. And we're going to need people out there to be tested semi-regularly. So we don't have a recommendation for that yet, but we will. Mike?
So the $300 million in CARES funding is directly tied to COVID-related expenses, but you've made it clear time and time again that the next installment from Congress should have more money for local cities.
Yes.
How much money does Kentucky need to make up for that loss?
Whew. So the question is the CARES Act money that we talked about today, along with the rest, is limited in the ways that it can be spent. There is additional flexibility than there was originally about public safety and public health, and that'll help the localities a lot. That'll help the state less so, but it still help. And we do have COVID-related expenses. But every city and county would tell you, without an additional CARES Act funding to help them out, our recession will be deeper, and there will be very serious cuts in state government that affect overall employment levels and services that are vital to people during these times. So we need Congress to do this. The longer they wait, the more harmful it can be, the more that can impact our markets, and it hurts the private sector too. I don't want to get you the exact number, but I was on a call today where they said government spending has a bigger impact during a recession than just about any other spending. It's like a 1.7, and I want to get that number right, multiplier on what is spent. It's imperative. It'll be devastating without it. We have the Consensus Forecast Group coming in to tell us how devastating it is for this fiscal year, but the next one, it could be dramatic. And I don't want to presuppose those numbers, but I bet it would be as deep as we have seen, certainly in my lifetime. That's why Congress has to do this. They did it during the Great Recession. Whether or not it's the HEROES Act, which provides a lot of money to states and localities, or another version, it just needs to get done. All 50 governors of all 50 states support this. Not political at all. It's just a matter of getting through this. When will the reopening guidelines be up for June 1st openings? Now, we have a lot of them up already. I just haven't announced all of them. We ought to have them all up by the end of the week. That is certainly our goal. And then it says, when do you think senior citizen centers will open? Not until at least the next phase. What we have seen when we look at the mortality rate, which we had in an older slide, I'll show it again tomorrow, is really harmful to our seniors. It is really harmful to our seniors. The President's reopening plan says through first 2 phases, seniors ought to, in their terms, shelter at place, and ours be healthy at home. I know you want to get back to those facilities. They are wonderful facilities, but it's not safe, and I think you would see a significant amount of life lost. Phil.
The NCAA is lifting their moratorium as far as the student athletes coming back to campus for working out. That's seen as getting fall sports possibly in the college level. Any thoughts about that?
Question is on fall sports. It's still a little early to tell. I think where people are trending is games without fans because it's the mass number. I mean, when you have fans that can spread, but some sports have a lot of contact too, and I want to be really cognizant that these are student athletes, right? They're not paid professionals, and we want to make sure that it is safe for them. Now, they are a part of an age group that respond the best to this virus in terms of health outcome, but they still get it. I know that when we talk about youth sports, it's going to be low-contact sports, and then on the high-contact sports, we're going to try to come up with guidance that lets you do individual workouts and team practices that don't involve the actual contact. So, there's a lot of contact in basketball. We don't think about it the same way we do football, but there's a lot of contact. Now, if we could get some guidance out there that would let people practice but not scrimmage, for instance, thoughts about having them spread out until we can get to the point where we think it's safer, which could be later in the summer. Again, we're watching all this. That's probably where we're headed on our guidance, but we expect for the youth, baseball, tennis, hopefully we can do swimming. Again, this isn't a pool that's open just for entertainment, but if we can get the guidance right there for low-contact sports that are out there. It's still going to be a real challenge when we look in the fall or any time without a vaccine to have 20,000, 30,000 fans in stands. But we don't want to presuppose where the virus is going. A lot could happen, and that's why we don't want to say no, but we do want to temper expectations. What is the status of Kentucky Kingdom? I believe that we're going to be reaching out this week to talk to them. That would be a Phase 3 opening. We're looking at parts of Phase 3 in July. It's about the number of people that are there, but we want to make sure that our experts are talking to them. We probably have not had enough communication with Kentucky Kingdom, but there is actually, to my knowledge, while there have been announcements that they can open in the United States, very few or almost no actual openings of amusement parks, and I don't want to be the first. I'll admit that. I want to make sure that we have seen and we have watched. Dollywood has said they'll make an announcement here soon. That's one that we've been watching, but we got to make sure that we do this right and that we don't have a 4-day period where we spread infection throughout the state. If we can do it safely at the right time, it's something that we want to look at, but we got to make sure that at the same time we don't agree to things that could spread it rapidly. So we'll be talking to them. Let's not presuppose an outcome there, but that's something we'll be doing here in this next 5 to 7 days. Will, welcome.
Looking at Indiana, they've moved up their Phase 3 to this Friday. It's 75% capacity in malls, pools open. There's movie theaters are back online. How much attention do you pay to what they're doing as a neighboring state, and how concerned are you for areas like Louisville and Henderson that share Indiana metropolitan areas?
Question is about Indiana and them moving up their timetable, even adjusted by population. Well, let me start off. I talk to Governor Holcomb on a weekly or a biweekly basis. He's got to make the decisions for his state, and I don't want to be critical of those. When you look at number of cases, even adjusted by population and death rate, theirs is higher than ours. But there's different factors, I guess, that go into everybody's decisions. What we know in looking at our data is a slow, gradual reopening gives us the right balance between restarting our economy and protecting lives. The other thing it does is it gives us the best chance to restart our economy in a way that lasts. My concern is you ramp up capacity immediately or in less time. I mean, in under 2 weeks or under 3 weeks when you wouldn't be able to see what the results are. What you risk is that big spike and not being able to pause it at a lower capacity. I don't want to reach a place where it is open everything immediately, fully, and oh no, we got to shut it down immediately because of what's happened. Our goal in the way we do this is to be able to make adjustments in parts of economy or different numbers that are out there, but also we got to put up the new Healthy at Work stuff. This has got to be a part of our daily lives, and to ask people to adjust to that just immediately is very, very difficult. I think we're doing this the right way, and we're trailing typically a place by a couple weeks at most. I think Ohio is slightly ahead of us, but not where Indiana is. And if you look at where we are in the country, we're not the fastest, we are not the slowest, we are right in the middle, which is, I think, where we want to be. And when I look at feedback, it's about a third think we're moving too fast and a third think we're moving too slow. So we must be in about the right place. But we'll keep watching. I mean, if we had a dramatic decrease in cases, we're not holding back to hold back. We're holding back for the health of our people. What initial reports are we getting about the first day of retail, and how will we determine when to increase capacity? So reports back seem pretty good. People are really working and really trying hard and being really thoughtful about how they do it. This is how we do this right. We're going to want to see at least 2 weeks of data. And remember, it's not 2 weeks on the button. Now, I've been asked a question, I think 2 weeks on the button when Georgia reopened something, and not every case would arise on the first day, but we are certainly going to be open to increasing capacity. Let's prove we can do it right. Let's make this part of our muscle memory, and then we will get there. Back to Joe.
I want to go back to the new ICU numbers from today.
Right.
How do you go from 269 to 98
We-
in one day, which I think 98 is the lowest you've ever reported
We-
since early April? And is there any concern that the hospital numbers are also way up?
Yeah, the question's on the major shift in ICU numbers, and that's legitimate. And are we concerned about the hospital numbers because of that? The challenge here in the data is the number of different groups reporting, when they report back in, and what you get. And that many people didn't leave the ICU yesterday. It's that we weren't receiving reports every time somebody left. So does that make me concerned that the hospital numbers, sure, it makes me concerned they might be too high. We're getting pretty good initial numbers going in, but it could be that more people are out. Now, our overall hospitalization rate is down. It could be that it's down further than it is, but that's a legitimate criticism. That is a very big shift, and it means we weren't getting data in the way that we should, and we got to do better moving forward on that. Now, it's also really good news to the extent that those that aren't on it anymore were ones that recovered instead of were individuals that were lost. On the data side, we'll continue to try to do better every day. What does it mean to be a dramatic increase? Why does it seem that there's a dramatic increase in probable cases, and are those included in the total coronavirus case totals being reported? So we actually break that down every day. The number of total cases, and then we talk about the probable cases versus the lab-confirmed cases. And this is something that the CDC and others advise that we do, and we get more probable cases in as we educate more of our groups out there about how to report this and what it means. So we will see the probable cases fluctuate even more than other numbers because some become lab-confirmed and some do not. But to be completely transparent, and we have this on our website, the probable. Okay, if we don't, we'll put it up on the website. 108 of the 8,167 total cases are probable at the moment. Now, what we don't do is we don't report when those numbers change. We report the overall new number and then the number that is probable. Again, this is something that the federal government suggested that all states do. It makes it a little more complicated. But I can tell you that we try to be as fully transparent and open about the numbers, show all the warts that may exist in them so that people can see them and make the best judgments they can. Mike.
The president says he's taking the antiviral drug hydroxychloroquine prophylactically, and he pointed to those other healthcare workers are doing the same. First, of course, the FDA has cautioned against using hydroxychloroquine for that. What would you say to Kentuckians who are confused about the conflicting messages? And the second part, maybe for Dr. Stack, do you know of any healthcare workers in Kentucky that are taking hydroxychloroquine prophylactically?
So the question is on hydroxychloroquine. I believe that people need to listen to their medical provider, that none of us out there know how to treat COVID-19, but our healthcare professionals do. This is a drug that to date has not been proven an effective treatment. In fact, it's been proven that it can be harmful. So to Kentuckians, don't push your healthcare provider to prescribe to you something that they tell you can harm you. They want you to get better. Your doctors you're seeing, if you have COVID-19, want you to get better. They're going to give you the best advice that they can. I would follow it. Ask all the questions that you need to. But this has not been proven to be an effective treatment. In fact, it may be able to harm you. Now, I don't know any of the conversations between the president and his doctors, and I don't want to get involved in that. But I do want to be really clear with Kentuckians that unless there are circumstances that we don't know about, it could be a dangerous treatment. Steve, you want to add anything? No. Okay. Apparently, I gave Steve's answer. When will we be able to reopen barns and shows? It's from the American Saddlebred Horses. I think we have a specific date on this. I know it is in early June. Let's make sure that we get it out to you. It's following a lot of the same protocols that are out there that can be done in shows, and that's going to be pretty much just those that are competing and those that are helping you get there. I know you got to haul your horse and prep your horse and do all the rest, but we're going to have that open soon. We need to get that guidance up. That's the same with other equestrian shows, and I believe, in fact, the horse park's even going to restart some major events here in the next coming month. But to the American Saddlebred Association, or the individual that owns American Saddlebred Horses, that's in the coming, I think, couple weeks, and we'll get that to you. I apologize for not having a date on me. Phil?
We got contacted by an individual that said that their husband works in the industry and was basically told that if they, the industry told them that if they did not wear a mask, even though this person had a kind of medical or physical issue, they would be fired. Any thoughts about that?
This is a question on a business telling an individual that they must wear a mask. Individual may have a medical condition. If somebody has a very serious medical condition where a mask would harm them, we don't want them to have to wear a mask. They should make sure they talk to that business about it. They should get their health care professional involved in that to talk to them. That sounds like one that ought to be worked out. Sometimes tensions get high, and sometimes communication doesn't always go in the way that helps us get the right resolution. That happens in government sometimes too. I've seen that once or twice. But it's one where if wearing a mask is going to harm you, if you have that medical condition, it's not that you don't want to wear it. It's that it would harm you. Don't wear it. I mean, in the end, this is about helping people, and we don't want it to ultimately hurt folks. But again, I also hope that all our leaders that are out there, local leaders, state leaders, that you wear one of these. This is just the most basic way you can protect another person. And as long as you think the virus is real, and as long as you think you can spread it through droplets, through coughing, and as long as you believe that there can be a lot of people that are asymptomatic, then you already believe everything that ought to lead you to wear one of these. It would basically mean that if you believe all of that, that you believe that you can make a decision to have this, to not know it, and to spread it to other people. I mean, we're better than that. We are good human beings. We have proven it. So let's do what it takes to protect one another. I do appreciate in the media and the press, people have really been modeling this type of behavior, which is important. and I appreciate that, and from so many others that are doing it. New report from a healthcare company says, it's a long question, just 15% of Kentucky counties meet minimum recommended coronavirus testing levels. Well, we've got 120 counties. Each county is not going to have their own testing. CDC recommends that states have capacity to test 1% of the population every 7 days. That's a little bit different that's coming out of the White House. And that rural counties need more sufficient testing. We've said the state has a lot of testing capacity, so how does it respond to this new report? Can you put up the slide? This is how. It is all over Kentucky. There is a testing site within 30, 45 minutes at most, I think. There may be one actually with Pineville, which we added. I don't think there is an exception to that. There may be part of our Mississippi River counties that are a little further away than Paducah or Murray than that, but we now have locations just about everywhere, and any hospital or medical center can work with our local health department to get them. We have the capability of testing anyone, anywhere now. Our issue as we move forward is that we need people to be willing to get tested. We have it now, but we got to keep it up. Will?
We get a lot of questions about, especially with Memorial Day coming up, about pools, public pools. What kind of guidance is the state looking at? Is there a timetable for getting those pools back online?
So we're looking at different guidance on public pools or shared pools, pools for entertainment as opposed to exercise and lap swimming. The exercise and lap swimming, if done the right way, and when we get to youth sports, we think for swim team that we can accomplish that in phase 2. We'll look at the possibility of public pools in phase 3, but we're going to have to see some really good data. The things that we haven't included in those phases are areas where you just don't see the type of social distancing. It's really hard to social distance at a bar, though it looks like bars are starting to adapt with the food service piece. It's really hard to social distance in a pool with a bunch of kids. It's really hard to social distance in daycare and childcare, so you're going to see some real conditions on that. Now, when we get to groups of 50 people or less, it may be that with a capacity level, we can, for certain pools or complexes, look at that. But I know it's summer, but this is an area where we know the virus had spread a lot. And opening pools right now would threaten Healthy at Work, would threaten our ability to do this the right way. All right, I had committed today to wrapping up within the hour. A lot of announcements today. We're going to continue to do this because the situation is so fluid, it changes, and we know that you want the information. But as we have a lot of things happening this week, retail, restaurants, getting together with 10 people or less, and next week you can get your hair cut. That's pretty exciting. Let's make sure we don't overdo it. I know that sounds like a dad, but it's really about the virus. Now let's make sure that we think about the level of contacts we'll have and not do all of them at once. We get one chance to do this and to do this well, and none of us have all the answers. So let's make sure that we make it all of our goals, not just to do what we say is allowable, but let's make sure we make it our goals to be successful, that we still continue to view the coronavirus as a real challenge, an adversary, and a deadly virus, and make sure we're doing our part to safely reopen. I believe at the end of the day, the way that we are doing this, when we look back, we're going to be really proud how we did it smart, how we did it safely, how we didn't just run to be the first, how we sacrificed when we had to sacrifice, and then we had what it took to do the new things we needed to do to be healthy at work. And so I know in closing, we have a special video today. This is out of Glasgow, and I think that you guys will enjoy this. I think this is our next great American Idol and her dad.
Hey, Steph.
Hi.
You know, with everything crazy going on right now, we could use a really cool song.
Yep.
What do you got?
What about 7 days?
Oh, that's perfect. That's your song.
Uh-huh.
All right.
waiting. Perfect lives we're making. Some people won't forget this day of their lives. But it doesn't wait till the 4th of July. This is how I'm making you a perfect today. But it doesn't wait today. Sometimes it even lets you play. You even have to say goodbye. Goodbye. Sunny days are waiting. Perfect lives we're making. Some people won't forget this day of their lives. But it doesn't wait till the 4th of July. This is how I'm making you a perfect today. But it doesn't wait today. Sometimes it even lets you play. You even have to say goodbye. Goodbye. Sunny days are waiting. Perfect lives you're making. Sunny days are waiting. Perfect lives you're making. Sunny days are waiting. Goodbye.
Think we did it, Stell?